Hello, Doctors Dixon, Enoch, and Koch. My name is Theodore Issen. I'm going to be talking to you about the effects of mindfulness practice on staff burnout, psychological flexibility, and job performance, and I'm going to be speaking as fast as I can. So those who work with individuals with disabilities experience high levels of stress, burnout, and turnover. In fact, they experience levels of stress much higher than the general population, high enough to indicate psychiatric problems, also much higher than the general population. We know that special educators are more likely to leave their jobs than general educators, and special educators who work with students with challenging behaviors are even more likely to leave their jobs. Now, this burnout can lead to many symptoms, including heart symptoms, depressive mood, absenteeism, turnover. For those that do come to work, it leads to less engagement with their students or clients, and less likelihood of carrying out a behavior intervention plan. Traditional organizational behavior management, or OBM, aims to control overt staff behavior by altering direct contingencies on the workers, and traditional OBM has had little to no emphasis on private staff events. That has been changing. A problem with this is that staff and their managers do not always have the options to alter direct contingencies in such a way. What may be helpful to staff would be a treatment that minimizes the effects of organizational factors and working conditions on variables such as stress, burnout, and turnover. Okay. For those humans that can speak, most have an advanced enough verbal repertoire to do learning from rules or verbal descriptions of contingencies. They do not need to contact the contingencies to learn in this way, and the rules do not even need to be accurate in order to affect behavior. Relationships or properties can be derived without being formally taught. For instance, if you know the size of a melon, you know the size of an apple, you know that a grapefruit is larger than an apple and smaller than a melon, you are likely to know about the size of a grapefruit. The ability to derive these sort of relations can also lead to avoidance behavior. Cognitive fusion is behaving based on thoughts and feelings at the expense of first-hand experience. Experiential avoidance is behaving in a manner intended to avoid unwanted thoughts or feelings, and psychological inflexibility is the rigid dominance of psychological reactions over chosen values and contingencies in guiding action. And these phenomena can explain why stressed and burnt-out workers may be more likely to avoid engaging in certain behaviors. Acceptance commitment therapy or training, either way is known as ACT, aims to increase psychological flexibility, the opposite of psychological inflexibility, defined as behaving consistently with one's values through 6 core processes. Okay, these are contact from the present moment, acceptance, cognitive diffusion, self as context, values, identifying values, and committed action towards these values. ACT has empirically displayed many benefits, including with the staff population we've been talking about. Improvements in stress burnout, worker behavior, well-being measures, and the behavior of parents working with their own children with intellectual disabilities. Mindfulness is going to be defined for this project as paying attention intentionally and non-judgmentally to the present moment, a definition used from Kabat-Zinn. From an ACT perspective, mindfulness can be seen as a synthesis of the processes of contact with the present moment, acceptance, diffusion, and self as context. Mindfulness has also been empirically demonstrating benefits with this target staff population as well. It has been linked to increased accuracy of data collection, fewer restraints being used with clients, and fewer staff injuries, and more happiness being displayed by clients. So really cool stuff. we wanted to see, in an applied setting, would mindfulness training increase the following, or improve the following variables: present moment awareness, psychological flexibility, both general and work specific. Would it improve burnout measures? Would it improve the frequency of staff-initiated interactions with students, the ratio of staff-initiated interactions to student-initiated interactions, and would it improve the accuracy of data collection? We used a multiple baseline across participant designs. And one reason for this choice was that it's hypothesized that the effects of mindfulness practice would possibly not be reversible, which would make an ABAB design, for example, not a wise option. The setting was a therapeutic day school where most students had been referred for displaying challenging behaviors. The students were aged 5 to 21. Most had diagnoses of autism spectrum disorder, developmental delays, emotional disorders, or some combination of the above. Each classroom consisted of 9 to 10 students and was staffed with a special education teacher, a behavior technician, and 2 to 4 paraprofessionals. Paraprofessionals were the population used for this study, and we had 3 young women who had been working at the school for between 9 and 18 months. So the inventories used as dependent measures were the Maslow Burnout Inventory, the Mindfulness Attention Awareness Scale, the Attention and Action Questionnaire, and the Work-Related Acceptance and Action Questionnaire. The third-party observational measures were staff-initiated interactions with students, student-initiated interactions with staff, and then a dependent measure used was the ratio of staff-initiated interactions with students to student-initiated interactions with staff. That was just a math formula. And another dependent measure was accuracy of data collection by staff. During baseline, each participant took each inventory once before the start of treatment. And the staff-initiated, student-initiated interactions, and accuracy of data collection were all collected by an observer during 30-minute sessions twice a week during baseline. The intervention was mindfulness practice sessions practiced in the morning and adapted from the AIM curriculum. So some exercises included sitting still, noticing one's breath, repeating a mantra, practicing mindfulness in a chaotic environment, noticing how music makes one feel, noticing the movements of music, practicing a high concentration activity, observing a novel object, coming back from a distracting thought, noticing nature sounds. The observation procedures during the intervention or treatment phase were the same as during baseline, so 2 30-minute observations a week of the staff and student-initiated interactions, as well as the accuracy of data collection. Each participant completed each of the same inventories once before the conclusion of treatment. Second observer was present for 33% of the observations and graded 33% of inventories. Okay. No participants improved in the burnout subsection of the MBI. No participants improved in the depersonalization section of the MBI. And no participants improved in the personal achievement section of the MBI. One participant did improve in the mindfulness attention awareness scale. One participant did improve, a lower score in this case is improvement, in the acceptance and action questionnaire. And no participants improved in the work-related acceptance and action questionnaire. For staff-initiated interactions, IOA was 92%. And we had 2 participants that had a significant, from the eye test, increase in the number of interactions. And they had percentages of non-overlapping data of 100% and 60%. For the ratio of staff-initiated to student-initiated interactions, we had 2 participants, again, with values that looked overall higher during treatment, with percentages of non-overlapping data of 100% and 80%. For accuracy of data collections, each participant had a mean percent accuracy during treatment that was higher than their baseline. So that change was observed for all 3. Okay, to reiterate, no participants improved on the MBI. 1 improved on the MAAS, which may confirm the validity of the AIM exercise in improving attributes of mindfulness. 1 participant improved the AAQ2 score. They may be at a lower risk for experiencing somatic symptoms of stress, such as heart problems and depression. No participants improved WAAQ. 2 improved in the number of staff-initiated interactions, initiating 186.7 and 46.4 more interactions, respectively, on average. This could lead to more happiness for their students. 2 also improved in the ratio measure, and all 3 participants improved in accuracy of data collection. 1 participant was out for jury duty for 5 days. This could have affected their stress levels or burnout levels. 1 participant quit during the intervention phase. This could have lowered stress levels once they quit. It also could have decreased motivation to interact with the students or take frequency data. There were sessions where no target student behavior was observed by the observer or participant, and this decreased the number of overall data points. Here we see that during treatment, the last few sessions, for Wanda, for staff interactions were decreasing. If more sessions were taken, this trend could have continued to decrease to pre-treatment levels. We're also seeing that for percentage data accuracy for Wanda, that the trend is increasing right before treatment. So this means that any of this change, which is a positive change, could have been due to another factor besides the treatment. Okay, and implications for future research. Previous studies have evaluated the effects of mindfulness practice on accuracy, however, not on accuracy of behavior frequency data, and especially not in an applied setting such as this. AIM curriculum was designed for children, but this study showed possible effects of AIM curriculum on the behavior of adults, and participants practice only 40 to 50 minutes of mindfulness in this experiment. Many other experiments, they practice between 2 and 12 hours. Future studies using this design could do more practice sessions for a longer duration to see if the effects are more pronounced.